Hi, Jamie Davis from the Nursing Show here at ANIA in Philadelphia. Nursing informatics is the topic of the day, and we're talking with Pat Mulberger today about a topic of shortages in nurses to do informatics, specialists in informatics. But before we get to that, Pat, tell us a little bit about your background as a nurse.
Okay, well, I graduated in 1979 from the University of Delaware and worked right up the road at Hospital University of Pennsylvania, HUP, for about 9 years, and then I transitioned into home health and OB, moved to Maui, Hawaii, and was an OB nurse there for 6 years, came back to Montana and was an OB nurse there in a small rural facility, and they wanted to implement a computer system, an order entry computer system. So I transitioned into IT by implementing their first order entry system, and then went on to implement almost all of their modules. In small critical care access hospitals, it's very common for the nurse to implement across applications like admissions, registration, billing, that kind of thing. So you get a lot of practice with what's going on across and not just your little piece of the pie. So I became a consultant then for many years and wandered the world doing some troubleshooting and implementations, and then I came back home to the hospital and went back to school, got my master's in nursing, got my nursing informatics certification, and I now work as a quality informatics supervisor.
So you've got your certification as a nurse informaticist, but a lot of hospitals, especially in rural areas and smaller community hospitals, are really not using nursing informatics specialists to do the work. They're just pulling nurses off the floor. That's
right. I help another critical care hospital. I help guide them, and they don't have a specific nurse working in informatics. So they have 3 or 4 nurses that take turns working in nursing informatics, and each person knows a little piece of the puzzle, but then they get pulled back to bedside nursing because they're short-staffed. So it's a very chaotic environment, and I don't know that hospitals recognize the need to have fully educated, very aware nurses that work in either IT or under nursing, but work with nursing informatics. And so this conference, the ANIA conference, is one. I brought 2 of my nurses, and they are just, their eyes are just opening up to see what the possibilities are. So this is a great conference.
Well, it's important. I talk all the time on the Nursing Show about the importance of going to your specialty nursing conference because of the networking opportunities, and somebody else has solved the problem you have.
Right.
If you get a chance to meet them, you're going to save yourself a lot of work, and I'm sure that's true for nursing informatics as well.
It's very true, and the good thing about a conference like this is it's vendor agnostic. So when I go back to my facility where I have a specific HCIS vendor that I work with, I hear all their solutions, right? But when I come here, this sparks the creativity of, wow, we could take our software and do something like that, and maybe even a little better. So you really grow, and it helps your creative juices, you know. We were already talking about, oh, we could do this, or oh, we could do that, and you know, you get back and you're busy with other stuff, but you realize that some of these things are really going to be time savers. And if you didn't have a nurse that understood informatics to put those 2 together, you wouldn't get that gain.
You're a nurse, let's say you're a nurse that's been a bedside nurse and loves having that clinical contact with patients, loves feeling like you're having that clinical impact on a patient's health. Tell me a little bit about how you feel a nurse in informatics still has that touch, because I think they do. I think they really do have an important part of having that very real impact on the patient's health care.
Oh, absolutely. I feel like I'm the nurse's nurse and the doctor's nurse, and I can supply them with the tools they need to really take care of the patient. And so I am one step away from the patient, but if I can give that doctor or nurse something that will help them connect the dots, make the care better, recognize they're going septic sooner, recognize that they've had a little too much pain med sooner, some clinical decision support tools, then I am taking care of that patient. It's just from a step away.
Excellent. Well, I want to thank you very much for coming on the show.
Thank you.
And thank all of you for checking out this segment here from ANIA in Philadelphia. We want to thank you for doing that and urge you to check out some more on nursing informatics. So stay tuned to this channel and over at NursingShow.com for more segments like this one.